Who would have ever imagined that a woman carrying around a lamp at night, caring for wounded soldiers, could have such a huge impact on nursing and health care? Florence Nightingale was born on May 12, 1820, and died on August the 13th, 1910. She was born to a very well educated, wealthy British family and was homeschooled by her father, and according to famous scientists, was often referred to as a math whiz. In her early 20s, Nightingale refused to continue to watch the suffering around her and began to help poor people in her hometown, and within a year was working at a hospital caring for patients. Nightingale felt like she had a calling from God and devoted her life to her calling. In her 30s, Nightingale moved to London and accepted a job where she was in charge of an institution caring for sick women. Her father began sending money to her to help. This is where her mission for a change in healthcare began. She worked hard to improve the cleanliness, nutrition, and the quality of staff caring for the patients. The news of her great works in healthcare spread quickly. In 1854, the British government asked her to take charge of nursing in Turkey. Because nursing had been looked upon as a disreputable job, Nightingale wanted to make a change. Nightingale handpicked 28 nurses to join her team. In the beginning, the doctors had no desire for their help, but soon asked for it. Nightingale was instrumental in improving the conditions of healthcare in Turkey. She quickly became famous among the soldiers because of the great improvements, according to Biography 2019. This is where she gained the name the Lady with the Lamp, because of the rounds she made at night checking on the soldiers. Her work during this time was responsible for the death rate decreasing from 50% upon her arrival to 2% after the changes she had implemented. By the time Nightingale was 40, she had written a book, The Notes on Nursing, and established the Nightingale Training Institution in St. Thomas Hospital in London. She not only improved the care for patients, but also made it possible for professional training to provide better nursing care. In conclusion, a young woman who followed her calling and was known as the Lady of the Lamp improved health care provided by hospitals and nursing.